In less than 100 days, Georgians will have a new way to call for help when they or a loved one experiences a mental health crisis. A new 3-digit number will launch on July 16th nationwide. It'll give you an easier way to reach the National Suicide Prevention Network and Mental Health Hotline. Liza Lucas has the latest from state leaders and advocates as Georgia prepares.
Jasmine Turner used to sit in these chairs as a participant, but for the last 6 years, she's helped others in recovery.
I personally have received so many calls of people dealing with just mental health crisis. Either they've been isolated, either they just can't take whatever it is that they're going through.
And that's where advocates hope the 988 crisis line comes in. The federal mandate offers an easy-to-remember number for those experiencing a mental health crisis and an alternative to 911.
Currently, when family members or a peer or somebody who's experiencing a mental health crisis call 911, they get a police response. And that's not what is needed.
Kim Jones with the National Alliance on Mental Illness Georgia says mental health situations need to be approached differently. And in Georgia, there is another option in place.
Currently, Georgia is fortunate. We do have the Georgia Crisis and Access Line.
Commissioner Judy Fitzgerald of the Georgia Department of Behavioral Health and Developmental Disabilities believes the state is better positioned than others for the 988 rollout, given the existing call center. But staffing will be critical. GCAL already responds to around 700 calls a day, a nearly 20% increase compared to the same time pre-pandemic.
What we're looking at is how can we meet this increased demand that we faced since the pandemic, and how can we continue to build the workforce of individuals who can respond.
Because during a crisis, the right response can be a lifeline.
Readily available, immediate help is going to be, I think it's going to be a game changer.
Again, the 998 line is going to be launching mid-July, and advocates and state leaders both, they tell me to expect a transition period as this all unfolds. Call volume is also going to be monitored very closely, with officials prepared to ask for more resources as needed to staff up. And here's an interesting perspective from Commissioner Fitzgerald, who tells me that the increase in calls that they're seeing, that also can be seen as a positive as the conversation around mental health is further destigmatized. She says more people are seeking help.